Hi everyone, hope you're doing well. Happy Woman Wednesday. Excited to bring today's topic to you. We're going to be talking about what you can learn from your senses about your partner's sexual health and honestly your own sexual health as well. So we'll get started momentarily, but super excited about today's topic about what any number of senses out of the 5 senses can tell you about sexual health. We'll just get Whitman-Walker in the room and then get started. In the interim, my name is Jewel, and I use she, hers pronouns, and during the COVID-19 pandemic, Whitman-Walker's Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics about HIV, STIs, sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you. So excited for today. We just got Whitman-Walker in the space. We'll get them on stage. Hope everyone's gearing up for the holidays, or the continued holidays, and enjoying watching the World Cup. Congrats to Morocco on, I think, what is defined or technically like an upset of a win. I think they beat Spain today, so we love to see the underdogs winning. Thanks so much for joining Whitman-Walker. So again, my name is Jewel, and I use she, hers pronouns, and today we're going to be discussing your senses and what they can tell you about a sex partner to inform your next steps. So to start off, let's define senses. There are 5 of them, and people can have any number or variation of or range of these senses. They may include sound, or what you hear, touch, or what you feel, taste, or the experience of your taste buds, sight, and what you may see, and finally, what your nose may smell. We also have to talk about sensuality versus sexuality. We often hear people use sensuality and sexuality or sex interchangeably. So Oxford Dictionaries defines sensuality as the condition of being pleased or pleasing or fulfilling to the senses. This can be small things like watching a video clip, listening to a podcast, or touching something soft and fuzzy. While tapping into various sensations, engaging in sensuality can be enhancing to a sexual experience. So to do this, one might light a candle with a favorite smell to please their nose, adjust the lighting and or temperature in a space to please their eyes and sense of touch, wear something silky and satin or latex to please their eyes and sense of touch, play some music from a favorite playlist to please their ears and their sense of sound or hearing. They might eat aphrodisiacs like strawberries or oysters or chocolates to please their taste buds, or they might conduct partner massages to please the senses of touch. As it relates to sexual health and pleasure, senses can tell you about another person's sexual health as well as your own. So we'll start off with sight, or what is visible to the eyes and what you can tell about infections. So if you see an open sore or open sores, multiple, or discharge that is yellow or green in color that resembles cottage cheese, or that could, or any of those items, that could be a sign of an infection. So this person with symptoms should seek out HIV or STI testing and a vaginal/front hole health screening if applicable. You can call Whitman-Walker at 202-797-4439 to schedule a testing appointment and to get connected to care. Again, those things to look out for are open sores or discharge that's yellow or green in color, or discharge that resembles cottage cheese. Now to smells. Smells can also tip you off that an infection might be present. So every vagina or front hole has its own natural aroma. If you notice an offensive odor or a fishy odor, this could be a sign of an infection. The person with symptoms should seek sexual health testing, screening, and support and pause sexual activities while they complete treatment. Next up, we've got look before you engage in oral sex or activities with your mouth. If you can view signs of sores, this may be a sign of warts or herpes. If you see discharge that resembles cottage cheese, this could be a sign of a yeast infection, so just use your eyes. Definitely want to examine things before you put your mouth on them, in the same way that you might examine what you put into your mouth food-wise. It's a good idea to just take a look at what you're putting into your mouth sexual-wise. And finally, I just want to remind you that if you or folks in your community need answers to questions about sexual health, or just need to access sexual health testing and screening, you can always call Whitman-Walker at 202-797-4439 for your sexual health questions, or to schedule an HIV or STI testing appointment in Northwest or Southeast DC. And if you're not located in DC, or our locations are not easy to commute to for you, just search for your nearest community health clinic, Planned Parenthood, or your local health department to access testing and treatment. Thank you for learning about what your census can tell you about your health and your sex partner's sexual health. Before we go, we want to give you a few reminders about COVID-19 and vaccines. If you've already been vaccinated, that is awesome. COVID is still around, still present. So just important to stay alert. There's not really many prevention steps in place for making sure, or ensuring people are vaccinated that you're around, or for mask wearing. So it really is up to you to kind of take that into your own hands. That said, if you have already been vaccinated, congratulations. You've taken a really big, important step toward preventing yourself and your loved ones and your communities from getting sick. Multiple variants have soared across the world, and it's totally understandable why you might want to keep wearing your mask, as the vaccine is not 100% effective at preventing new cases of COVID-19. And we continue to have more contagious variants spreading, and there are just few protocols in place to actually verify that folks around you have been vaccinated. So just keep staying alert. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has COVID-19 vaccine available. Please reach out to us at 202-207-2480 to make an appointment. And if you're having trouble making an appointment with Whitman-Walker and you're a DC resident, you can visit vaccinate.dc.gov or call 1-855-363-0333. Maryland residents can visit covidlink.maryland.gov or call 1-855-634-6829. And Virginia residents can visit vaccinate.virginia.gov or call 1-877-829-4682. If you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines for mask wearing, social distancing, quarantining, and the like. It's super important that you consider getting the vaccine and discuss COVID precautionary measures with those who are around you, and to be mindful of mask and keep your distance, but especially when you don't know whether a person has been vaccinated or not. And since we're in the middle of another public health emergency or pandemic, let's talk about monkeypox. According to the CDC, there are more than 29,000 cases of monkeypox documented in the U.S. And in DC, you can register for a monkeypox vaccine appointment at preventmonkeypox.dc.gov. Virginia is working with local care providers to contact, trace, and identify those who are most in need of a monkeypox vaccine. And Maryland released a pre-registration system. So if you're a Maryland resident, you can visit the state's health department website and pre-register for an appointment. And if you are not in the DC, Maryland, or Virginia area, just look up your state's local health department websites, and they'll be able to direct you in terms of what to do for monkeypox prevention and access to vaccines. DC has walk-up vaccine locations. It's provided on a first-come, first-served basis to eligible residents, and the hours and locations vary by day, so just definitely visit preventmonkeypox.dc.gov to see the latest hours and locations for what's in your neighborhood. Thanks so much for tuning in, and please remember to follow Whitman-Walker on Instagram, Facebook, and Twitter at Whitman-Walker, and check their website at www.whitman-walker.org for the most up-to-date information on their services. And for more COVID-19 resources, as well as general Whitman-Walker services, please give them a call at 202-797-4439. You can also follow some of their programs and Whitman-Walker family at RealTalkDC_ and at NoFilterDC. And thanks so much for the earrings comment, Coffee Press. Much appreciated. Hope you're doing well. Bye, everyone.